Good evening, everyone. My name is Jessica Miner, reporter for NUR 7246 Drug News. Today, I'm going to be reporting to you on the drug class nitroimidazoles. The drugs in this class are benzodiazole, metronidazole, sulfonidazole, and tinidazole. However, today in this video, I'm going to focus more on metronidazole or Flagyl, which is one of the more commonly prescribed drugs. So the action of this drug class is it interferes with DNA, which inhibit protein synthesis and cause cell death for susceptible organisms. The therapeutic effects of this drug class, and specifically Flagyl, are the resolution of symptoms caused by the infectious organism. The pharmacodynamics are not completely understood. However, the drug specifically disrupts the DNA and protein synthesis, causing cell death for susceptible organisms. Flagyl is specifically bactericidal against gram-negative and gram-positive anaerobes. Tinidazole is similar to Flagyl in that it deactivates the DNA after undergoing a nitro group reduction. However, it is antibacterial and antiprotozoal. The pharmacokinetics, it is readily and rapidly absorbed and is widely distributed to most tissues and fluids in the body. It also crosses the placenta and the blood-brain barrier. Flagyl is specifically metabolized into several degradation products, and the majority of those are renally excreted. However, tinidazole undergoes extensive metabolism and is excreted by the liver. The pharmacotherapeutics, there needs to be caution with patients with history of blood dyscrasia, especially with Flagyl. Seizures or neurological history, and caution for patients with hepatic dysfunction. A disulfiram-like reaction can occur, so patients should be cautioned that no alcohol use is warranted. And of course, if there's history of hypersensitivity with any of the drugs in this class, patients should not use. Flagyl is a pregnancy category B. There were reports of some cleft palate formations in women that used this drug in the first trimester. So Flagyl is contraindicated for the treatment of trichomonas in the first trimester. Tinidazole is specifically a pregnancy category C. Women who are currently breastfeeding should talk to their provider before using this drug. Children can use Flagyl for amoebiasis, and for children greater than 3 years old, amoebiasis and giardia can be treated with tinidazole. Serious drug reactions can occur, such as seizure, peripheral neuropathy, hypersensitivity, Stevens-Johnson syndrome, toxic epidermal necrolysis, aseptic meningitis, leukopenia, and thrombocytopenia. There is a black box warning that this drug was used in an animal study and it was carcinogenic, and hepatotoxicity. Some common drug reactions are mainly involving GI upset, such as nausea, vomiting, diarrhea, abdominal pain, epigastric discomfort, headache, metallic taste, and a dry mouth. The biggest interaction is with alcohol. Of course, we talked about the disulfiram-like reaction, so patients should be counseled no alcohol use. Flagyl can potentiate anticoagulant effects in warfarin, and Flagyl may increase lithium levels. Flagyl is used for amoebiasis, anaerobic and bacterial infections such as bacterial septicemia, bone and joint infections, CNS infections, endocarditis, different gynecological infections, intra-abdominal infections, lower respiratory infections, skin infections, surgical prophylaxis, specifically in colorectal surgery, trichomoniasis, and animal or human bite wounds. The rational drug selection depends on the organism that's being treated. However, Flagyl is typically the drug of choice because of its efficacy and its cost. It's typically lower than $4 at most retailers. For patient monitoring, typically resolution of symptoms indicates an effective treatment. Of course, further treatment is required if symptoms do not resolve or other symptoms do occur. Patient education, patients should take this medication with food to resolve the GI upset that can occur. For specific forms of Flagyl, such as the vaginal Flagyl, physicians and nurse practitioners should teach patients in office how to use those drugs. Patients can chew gum to overcome the dry mouth. Patients should notify their provider if a hypersensitivity reaction occurs, and patients should be counseled to avoid alcohol. For lifestyle management, patients should be counseled that a lot of the indications for the use of these drugs involve sexual infections, so patients should be counseled on safe sex practices. As far as the GI reasons for using this drug, the GI infections, patients should be counseled on hygiene and specific hygiene reasons when foreign travel is involved. I'm reporting to you live from my bathroom to discuss some of the main takeaways for the use of Flagyl. I'd like to remind you that patients should be counseled on the use of alcohol while using this drug, or any of the drugs in this class. A disulfiram-like reaction can occur, such as tachycardia, hypotension, intense vomiting. Flagyl is contraindicated in the first trimester for the treatment of trichomonas. And finally, please counsel your patients on safe sexual practices. That concludes NUR 7246 Drug News. Thank you so much for watching.